Pikeville Medical Center continues its commitment to providing quality regional health care in a Christian environment, providing the health care that we have needed so badly in this region. Today, that health care is reality with help of Pikeville Medical Center. I'm your host, Jill Fraley-Dotson for Health Talk today. Welcome in to Pikeville Medical Center. I am here with Pikeville Medical Center COO Juanita Deskins, and we are going to spend, Juanita, the next few minutes talking about where Pikeville Medical Center started and where it is today. A lot of things have happened over the past few years. We're getting ready to announce the grand opening of our new clinic building and parking garage, which we will take a tour of shortly. But what a wonderful, wonderful time it is for Pikeville Medical Center.
Absolutely, Jill. We are so excited for this time of the year. We've worked so hard over the past 2 years getting this facility ready. So we're so excited to invite the community in and start utilizing it.
Absolutely. It has been such a staple of our community for so many years, and you've seen it grow by leaps and bounds over the past few years. But take us back to the beginning, how it all started.
Sure. It started back in 1924 on the Hill, what we hear local
Call
people.
The Hill. You're right.
We call the Hill. Where University of Pikeville College is located. I think it's Wigham Hall is there at this time. Very small facility. Then in 1952 was what they called the Miners Hospital. Then in 1971 we had the Elliott Building, and it was like an 8-story building. And then in 2000 it's the May Tower. And when we built that tower, we really were all thinking, wow, this is huge. Are we ever going to fill this space? And probably within a year, we already started having departments saying, I don't have enough space. So throughout the years, we started evaluating, where do we go next? Yeah. And we have started a trend where we hire lots of physicians, and we needed a place to put our physician practices.
So we needed a new building.
We absolutely needed a new building.
Well, that's why we're here today. We're going to talk about the new clinic building on the campus of Pikeville Medical Center. No longer do you have to go to various places. You'll be able to come to one location and also park in the same location with a massive parking structure that will provide access to each and every floor from the place that you're going to park. So that's a plus in and of itself. Let's start with the building. What can we expect from the new building overall?
Okay, we've got an 11-story clinic building that's going to house all of our physician practices. It's going to be the 2nd floor, the 6th, 7th, 8th, 9th, and the 10th floor. 3rd and 4th is going to house our ORs and our pre-op and post-op. Mm-hmm. In addition to that, we have a parking garage, which is 10 stories. And what that allows for our patients, they're able to drive up to the floor where they see their physician and be able to park there and just walk on in.
I did that today when I arrived. I needed to be to the 2nd floor, so I entered the lower level of the parking structure, drove straight up to what will be the main entrance of the new building, came right onto the floor, and the elevators are right there. There's an information desk, so if you have any questions, they can point you in the right direction. But it's so easy and accessible for our patients.
Isn't it great? Mm-hmm. Before they had to go in through our Harold's Branch area, they'd be dropped off at the Miners Building and then have to walk or find their location, or either we had a place out in the community that they may have to go to. But then if they needed other care, they'd have to schedule another appointment. Right. Now with everything being attached to the hospital, if they need another procedure done, then our goal is to have that accomplished that day. So we save less trips for our patients to have to make back and forth.
Now you mentioned the floors earlier. 2, 6, 7, 8, 9, and 10 are all laid out the same.
Absolutely.
So if you have to be on one floor and then go to a different floor, it's pretty easy to maneuver throughout the floors.
That is true. We really kind of mimic the Mayo Clinic version of how their clinic is set up. We have 32 exam rooms in our physician practices. We also can house 10 physicians at one time on one floor. And each floor is identical. Supplies are going to be located in the same location because it makes it more convenient for the staff also. If they work on one floor and have to go and work on another floor, they'll know how to locate and find things to be able to help them. Plus the patients, it'll be more familiar to them also.
The one thing that I think most people think about when they go to hospitals and have to wait for extended periods of times, because unfortunately sometimes that is the case, they're very uncomfortable when they're sitting in the waiting rooms. But all of our waiting areas are so vast and very, very comfortable. And that was very important to you when deciding
Absolutely.
the furniture even.
Yes, the furniture, we can seat up to over 100 people in one waiting area. So we've really expanded those. And we've tried to decorate it to where it's very soothing to the patient. We have great artwork, which is really from our local community, our pictures. Plus we got high definition TV in the waiting areas, so if our patients want to be able to view something at that time, they'll be able to do that. But we also are expecting to have our processes realigned to where our patients don't have to wait that long. That, once their data is entered, even before they get here, and then they just have to check in, then they'll be called back to see their physician. So hopefully they'll see that transition, how we've also realigned some processes by being able to get into this new building.
And that leads me to the monitoring system that we have now. You mentioned the high-def television screens that are on all of the floors. You can actually track and monitor your patient's progress through those. So the waiting time gets a little bit less nerve-wracking sometimes, because we all know when we're in a hospital, regardless of the procedure that you're going to have, it is still a medical concern.
Absolutely.
And nerves are a big part, but that kind of lessens the nerves, I think, a little bit.
I think so too. Our employees that are working here, they can tell when a patient goes into a room, an exam room, plus the doctors can also view it with our technology. It's called the expediter. So they can tell if a patient's already been checked in and they're waiting for their physician, then that doctor can identify where his patients are and go straight in and examine the patients. Or the nurse will know that the clerical staff has just put a patient back in an exam room, so they can go in and do what they need to do, and then they'll identify to the physicians, and they all can just look at the tracking board and know how that patient is traveling through the clinic.
Clearly speeds up the process.
Absolutely.
A great deal. Let's
Absolutely.
take it floor by floor, shall we? We've talked about the second floor where you enter the new clinic building, and you'll see it's right off of the atrium of the current building.
Correct.
And then the third floor, the waiting area is the same, the monitoring system is the same, but the pre-op and post-op area is much larger than it was before.
Absolutely.
What was it, 11 and 13, I think,
Yes,
pre
we
and
had
post?
like a total of pre and post-op about 24 rooms. We have really doubled it.
Right.
We have increased it to 50 pre and post-op rooms. And, we can start out on one side and expand to the other. It's interchangeable. If we start out in the morning time and we have a certain number, then we expand through the day with recovery, with the post-op, then we have sufficient numbers of beds to be able to house our patients.
And it really is a large area. As I mentioned on the tour that that I was able to take, it was amazing to me to see the space, number one, but how easily those rooms could be interchanged. If you needed more post-op beds than pre-op beds at that time, it's very easy to maneuver.
Yeah, absolutely. Just like walking across the hallway and the rooms are already set up and ready to go. And we also expanded, before we had like one isolation room, and now we have 2 isolation rooms. And as you mentioned earlier, we got state-of-the-art monitors for our patients that's in post-op. And we've got new systems for our pre-op patients to go through, so we're very proud of the area.
I'm glad you mentioned the isolation rooms, because as a person that's not in healthcare, sometimes I forget that rooms like that are needed for certain things, but we have those here, and they are completely quarantined. And although you hope you never have to use those sort of facilities, it's so nice to have those here when needed. Certainly
Absolutely.
so. And let's talk about the sterilization process of some of the scopes and things of that. It is the most high-tech system that I've ever seen.
Yes, we got all new equipment for our central sterile supply area to sterilize our scopes. We also purchased all new scopes for this facility. So our physicians are very excited about getting in and using the new scopes and the new equipment, and our staff is very excited also.
The one thing that I think is very easy for the patients, like we mentioned, you're very nervous when you come in for a procedure, regardless of what that procedure is, but when you go into the rooms and they're gathering the information, all of the patient information can be entered right at bedside.
Absolutely.
So there's no going back and forth, and that had to be something that you all gave great thought to.
We did. And, you know, not only at bedside, our goal is to make sure we have a lot of it pre-registered even before the patient gets here. And then we won't re-ask the same questions. There may be just verification of the insurance or getting copies of the cards. But our goal is to capture all the information before the patient gets here. It's our goal to make the experience more and more easier for our patient. We're always wanting to focus on the patient.
Absolutely.
And give them the best care possible, and also be more efficient and to make them feel more comfortable. Something else that we've added is what we call a physician portal. This is where patients can go in and view their own labs or their own record. So that's something in addition that we're opening up. All they have to do is get registered. Our staff will help show them how to do that, and they'll be given a password and they can check their results. They don't have to call back to their office and say, hey doctor, what is my lab result, or what is this report? They now can go online and get that.
How wonderful. So I could, if I came in for an exam or an x-ray or a scope if need be, I could go to this patient portal from the comfort of my own home and check all of my results.
Absolutely.
And if I had a question, could call back.
Absolutely.
Now, is that something that's done elsewhere? I have never heard of anything like that.
It's a
with
new
a medical
trend
field.
in healthcare that, you know, it's the kind of the nature of the beast with healthcare, is trying to make that information more easier for the patient to be able to acquire, and that they're part of that healthcare decision. So the more information you can give them, the better knowledge they have about, you know, what their own health condition is.
Because sometimes I think when you're sitting down with your physician and you're getting results of whatever test it may be that you've had, sometimes it's hard to comprehend and listen to everything that is said because there's so much information. But how nice it is to be able to be home and do that.
Yeah, you know, I can look at it at home, and then I can kind of take it all in, and then like you say, if I'm real concerned about it, then I can get on the phone, call the nurse, call the doctor, and it's very easily acquired.
And while we're on that subject, let's talk about that. If you ever have any questions, it is so easy to call back now and speak to the nurse so they can provide a little bit more information, something that might not be as easy in other places.
Absolutely.
Certainly here, that's a plus.
We have absolutely tried to streamline that process, that they just call the one number and be able to get in touch with the nurse. And it's just trying to streamline some of the processes that we were not able to do when we had so many practices throughout the community.
But also keeping that personal touch, and I think that's what's so important, especially in a small community, but in a region that that really puts emphasis on family and communication. You still get that same feeling when you're here at PMC.
That's something we've always talked about here as our employees work here. We feel like one big family, so we want to always include our patients and their families into our family so they feel as at ease as we do.
And I've certainly had that experience, so thank you for that. Let's move on to the 4th floor. Now, on the 4th floor, we have 6 state-of-the-art endoscopy rooms. This is a totally different looking floor than what it was before. It is so impressive.
Absolutely. We really increased our endoscopy rooms from 4 in our existing building to the 6 due to the growth that we've had in that service. And we also added 8 more ORs. And what that allows us to do is in our current operating room in the May Tower, we have 12 ORs. So it now allows our physicians to be able to have 2 rooms. That way one room can be set up while they're going ahead and operating on one patient. That by the time they finish that, they can go to another operating room and go ahead and start that process while they clean that room and get it reset up so when they finish the current surgery that they're working on. And this will really help turnaround times for the physicians, for the patients, because they can get in and out quicker and be able to actually just be in there, concentrate on doing the surgeries. So our physicians are extremely excited about being able to get that additional space.
I'm sure they are. Now, in the endoscopy rooms, there's a new boom system. There's several different levels of that floor, and I want to take it piece by piece because so many people have to utilize this particular part of the clinic building. The new boom system, explain that if you will.
Okay, on the booms is where everything can be hooked up to one area without having all these wires and everything crisscrossing in the ORs and going, you know, all over the floors. It all just is hooked up to the booms, and it helps streamline it. in addition to the booms, we have an integration system, and this is the state-of-the-art technology for monitoring. So if a physician is doing a type of surgery or anything, he can bring up all the images and put them on one screen without having to look at 4 or 5 screens like they've had to do in the past. So this integration system and the booms are going to make it so much more efficient and so much more state-of-the-art for our physicians to be able to utilize the equipment.
And everything is off the floor.
Absolutely.
It is completely clear. That's the one thing I noticed immediately is that
Absolutely.
in other times, I guess you could say, you would have a lot of cords and cables and rolling carts and things of that nature, but that's not the case in these new rooms.
No, with those booms, it absolutely clears up your floor space, so that gives them more space to be able to use this other technology that we have with their other equipment that they bring in for different surgeries.
And there's also anesthesia in each room.
Yes, and we also have state-of-the-art anesthesia machines that we purchased all new, so we're very excited about those also.
OR suites. We have additional OR suites. Again, the state-of-the-art integration system, the anesthesia, the beds and lighting, a totally different feel than what it was before. I was able to go into some of those. And I will tell you, I'll be perfectly honest with you, when I went in there, you know, you look around, and if you've never had a surgical procedure before and you look at it from a standing position, you think, my goodness, there are so many things in here. But then knowing what I know now, I feel so much more comfortable if I ever have to have a surgery, knowing that everything is where it needs to be, that it is structured exactly the way that it needs to be. And I encourage everybody to come and take the tours because they will get to see those facilities.
Oh, absolutely. As I mentioned to you just a few minutes ago about the integration system, this makes the surgery so much more efficient for the surgeons to be able to monitor as they're doing the surgery, because they can have images right on the screens as they're doing the surgeries. So they're very excited about the integration system. It is definitely new technology.
We talked about the scopes and the new equipment that was purchased. There are new sterilization washers that I was able to take a tour of also. It's amazing to me the technology that goes into providing the sterilization for this equipment.
Oh, absolutely. Well, if you really think about it, Jill, they turn those cases around within minutes. So as soon as they utilize a scope, they've got to be able to get it into a high efficient washer to sterilize it and then start to get it ready for the next patient. Now, we do have several scopes, but as your volumes pick up, you have to have different ones, so you do have to wash those in these sterilizers that have the turnaround times to be able to take care of your patients in a timely manner.
It is an amazing building. Floor by floor, inch by inch. It's amazing when you come in and you look from what you mentioned earlier on in our show, talking about where we started on the hill, to the Miners Building, to the May Tower, and now to our new clinic building. Certainly state of the art. And Pikeville Medical Center, we always say, is committed to providing that quality health care, but really this just takes it one step further.
Absolutely. The thing that we really want to make sure our patient has is that the greatest experience they can have going anywhere. So we're trying to get everything as efficient as we can, and by doing that is by offering these state-of-the-art buildings and facilities and equipment and having everything at their fingertips so that they'll be able to get the information that they need. Some other things that this is going to allow, we talked about earlier with the patient being able to come to second floor if they're going to see a particular doctor and be able to park there and be able to go in to see their physician. Also, if I'm a patient in the hospital, if I'm on 6th floor, 7th floor, or 8th floor, I can park in that garage on either the 6th floor, 7th floor, 8th floor. My family members can, my friends can, and just come on into the building. So it's going to make it more efficient for that. When we discharge patients, they're going to be able to be discharged from those floors. So we're, again, from the patients, the first time I see a physician, until if they have to go into the hospital. Hopefully that makes their stay a little bit more better and they're more comfortable, and they know that we're trying to give them the best care possible.
Everything built with the patients, visitors, and family in mind. Quality and convenience, certainly something that is always of top mind awareness here at Pikeville Medical Center. And this is just the beginning. We'll have another project soon to talk about.
Absolutely. You know, I have no doubt that we have a fantastic visionary, Mr. May, our Chief Executive Officer and Board President. That's one thing he's continuously looking at. How can we improve it? How can we make it better? That we never get satisfied with status quo. So most of the time, as soon as we complete a project, we enjoy the successes, but then we're always looking at continuous improvement. How can we make it better for our patient? Because that's what we're all here about, is to take care of our patients.
Absolutely. Well, I, for one, certainly look forward to the next chapter, the next project, because this one is really, really outstanding. And congratulations on the opening of the parking structure, the new clinic building. This is just one more example of how we continue to provide that quality health care in a Christian environment right here at home, Pikeville Medical Center.
Absolutely.
Top-notch.
Yeah, we're very excited.
Thank you so much for your time
you.
today. I know you're busy. I know you're excited. And like I said, there will be one more announcement coming up very soon, I'm sure.
Absolutely. We just continuously grow.
Thank you so much.
Thank you.
For Pikeville Medical Center, a proud member of the Mayo Clinic Care Network, I'm Jill Fraley Dotson. Thank you so much for joining us.